Where did your breast cancer originate? Invasive ductal carcinoma is the most common type of breast cancer. It's found in about 80% of all breast cancers. It originated in the milk ducts, but it's spread to surrounding breast tissues. If left untreated or fairly unresponsive to treatment, invasive ductal carcinoma can spread to the lymph nodes and other parts of the body. About two-thirds of women diagnosed with IDC are 55 years or older, but younger women can receive this diagnosis. Men can also be diagnosed with invasive ductal carcinoma. I was 43 years old when I got diagnosed with with invasive ductal carcinoma, so it is true that it's not always something that older women get. Invasive ductal carcinoma may not be detected at first. Abnormal areas may be initially discovered from a mammogram, and this leads to further imaging and testing. So it's very important to be familiar with changes in your breast tissue, as the first signs of invasive ductal carcinoma might be found in the following signs. They might be found in swelling in all or part of the breast. Looking back, I recall that I had some skin irritation. One of the pictures in this course will show my dimpling. There was, you might also have breast pain or nipple pain. I believe I may have had an inverted nipple that I wasn't paying attention to. I just thought that might be a sign of aging. There might be some skin changes. It might be, your breast might be red or scaly or thickening. There might be a nipple discharge or a lump found in the underarm area. Then we have invasive lobular carcinoma. It follows invasive ductal carcinoma as the second most common type of breast cancer. About 10% of all invasive breast cancers are ILC, or invasive lobular carcinoma. Invasive lobular carcinoma originated in the milk-producing lobules that carry into the ducts, that carry milk to the nipple. If it's left untreated or fairly unresponsive to treatment, ILC can spread to lymph nodes and other parts of the body. Though two-thirds of women diagnosed with ILC are 55 years old or older, younger women can be diagnosed with ILC. Invasive lobular carcinoma may not begin with any symptoms, and an abnormal area may show up in a mammogram, and it results in further testing. Different to invasive ductal carcinoma, invasive lobular carcinoma is usually more difficult to detect in a mammogram. Instead of forming a lump, cancer cells from ILC typically spread to surrounding connective tissue in a line. Usually a thickening or hardening of the breast is first felt, and there may be fullness or swelling, skin texture changes, or inverted nipples. Ductal carcinoma in situ and lobular carcinoma in situ have something in common because they both indicate that the cancer or precursors to cancer were found in their original spots. In the case of ductal carcinoma in situ, the cancer was discovered in the ducts and has not escaped the ducts. In the case of lobular carcinoma in situ, the precursors to cancer were discovered in the lobular area and they haven't escaped the lobular area. Though both of these diagnoses have not invaded surrounding tissues, they have the potential to progress into invasive ductal carcinoma or invasive lobular carcinoma. If you're diagnosed with either ductal carcinoma in situ or lobular carcinoma in situ, you have a higher risk of developing breast cancer 5 to 10 years after you're initially diagnosed than someone who has never received any kind of breast cancer diagnosis. But the chances of recurrence are under 30%. The American Cancer Society states that 1 out of every 5 breast cancer diagnoses are ductal carcinoma in situ. Because LCIS is not considered a true breast cancer, it is more often referred to as lobular neoplasia. It's usually diagnosed before menopause, and it's found in women between the ages of 40 and 50 years old. Because LCIS does not cause symptoms, it's rarely discovered through a mammogram. Most LCIS is found upon biopsy for some other reason. And I do have a personal connection to this. I was initially diagnosed with invasive ductal carcinoma of the right breast, and for most of my cancer treatment, they were focusing on that right breast, and they weren't really looking at the left one. They did do CT scans and MRIs before they even started my treatment to make sure that the breast cancer on the right side didn't spread anywhere besides the lymph nodes. But they weren't paying attention to the left breast. And then after radiation in October of that year, around Christmas time, they did a mammogram of my remaining left breast. I knew something was wrong when they told me to hang around in a room and wait for them to talk to me instead of just sending me on my way. And they said that I had lobular, they didn't know exactly what it was. They had a question about that left breast, and they set me up for an appointment to get a stereotactic biopsy. They claimed that they got all of the precursors to cancer out of my left breast through that stereotactic biopsy, but because I do not have very good experience with biopsies, I insisted that they take that left breast when I had my reconstruction. And I am glad that I did so, because they have a protocol when they do a mastectomy of any type, whether it's warranted by the doctor or the patient insists on it. And they sent it to pathology, and it came back as lobular carcinoma in situ. While that is not considered cancer, it is a precursor to cancer, and I did not want to have to go back and have that taken care of 5 to 10 years down the road. I was also diagnosed with my initial breast cancer of invasive ductal carcinoma at 43 years old, and that following before that following year started, they found that lobular carcinoma in situ in that left breast. So chances could have been that by the time I was 53, they might have found something in that left breast as well. And so, yes, it is also, I was between those ages of 40 and 50 years old when they found that on the left side. And it was not discovered through a mammogram or any kind of imaging. It was found because they did that stereotactic biopsy, and I insisted on the mastectomy on the left side as well.